Name's Raj, as Matt mentioned. I'm one of the co-founders of Foundation Physio. We've been in operation for almost 10 years now, and I'm also a certified certified in vestibular rehabilitation therapy, which means I work with patients that have experienced dizziness and vertigo. And the reason for today's webinar was particularly to help put some of the questions, the unanswered questions about dizziness and what these symptoms are. And we thought that using this platform would be a great way to get that information out. Also, I've noticed in my practice recently, especially with the pandemic, that there's been a lot more complaints of dizziness and vertigo. And, I wanted to kind of explain, and I myself wanted to understand why that was. Was that due to anxiety? Was that due to posture? Was that, what was in the air that was creating more of these issues? And then obviously, want to present that information to you guys as well, or to the audience. So feel free to answer the question, send your chat messages. Matt will send them to me, and we'll try to keep it interactive. I have some polls, and then at the end we'll answer some questions, and I'll give you my information. So if you need to reach out to me, you can, and we can go from there. So a little bit about myself. I'm a physiotherapist. As I explained, I've been in practice for about 10 years. I did my my postgraduate courses from the Balance and Dizziness Clinic of Canada. So there's a few courses in which you have to take over a span of a few weekends. It allows you to understand vestibular conditions a bit better. And on top of that, I'm also a member of the Vestibular Disorders Association, which is a group of professionals, physiotherapists, chiropractors, doctors alike, in Canada, the US, and I regularly get a lot of material and research from data, and I'm a standing member with them, and so a lot of the information comes from their resources as well. So I just wanted to let you guys know where some of this information is coming from. and a lot of this information is also coming from my years of practice and the patients I've been seeing over the years. So today we'll be discussing 4 different topics: understanding your dizziness, understanding your symptoms and the possible causes. This is probably going to take the large chunk of today's talk. It's to help understand what is dizziness and where is it coming from, okay? And then understanding our inner ear system, because we always seem to put the two together. The dizziness symptoms must be coming from my inner ear, but that's actually a myth. That's actually not always true. What is vestibular rehabilitation? So what can we do on the physiotherapy and the rehab side? What does treatment look like? And what are some take homes that you can do, going forward today? I do want to warn you that it's not going to be, if you've looked at YouTube videos and things, people are going to watch the Epley's maneuver. The reason why I'm not going to be teaching the Epley's maneuver is the Epley's maneuver is actually not indicated for everybody. And I'll explain as we go through the seminar why we don't want to always just be automatically doing that maneuver. I'll teach you some other techniques, and then leave some room for questions at the end. Okay. Matt, there was a hand that was raised. Do we answer that later, or? I guess we will. Okay. So symptoms and causes. Dizziness. What is actually dizziness? Dizziness is not actually a true symptom in the medical sense. It's kind of used to describe a wide variety of symptoms. And I have had every single one of my patients over the last 10 years come in with this complaint of dizziness. But when I sit and ask them, what is dizziness? What are you actually experiencing? And break it down, it's actually such a different, everyone has a different explanation. Some people say they're woozy. Some people say they feel off balance. Some people say lightheaded. Some people experience headaches. There's the concept of oscillopsia, which is hazy or blurry. So like my eyes aren't tracking properly. My eyes are jumping back and forth, nystagmus. I feel fatigued and tired. I feel nauseous, and obviously the classic vertigo. I'm just gonna launch a poll here. If you guys want to answer, do you guys see the questions there? What symptoms have you experienced or are you experiencing? Just to get an idea of what people are feeling. And you could probably choose, I just want to get an idea based on kind of the participants. What is the major complaint? Got another 20 seconds. Awesome. Okay, a few more seconds. Submit your answers. Cool. So it looks like vertigo is obviously the number one symptom, and I'm gonna challenge you, and let's figure out if it really is vertigo. But I do see that a bunch of people have experienced all of them, all of those symptoms. A bunch of people also feel off balance, the sense of what's called disequilibrium, and then those feelings of woozy, hazy, nauseous, people experience as well. And it's not none of these symptoms are isolated to a specific cause or specific syndrome. Sometimes they all come together. Sometimes one happens first and the other comes. And as I explain over the next few slides what is going on, it might help put things in perspective. Oh, let me share those results with you guys so you guys can see that. Okay, awesome. So vertigo is actually the specific sensation of the room spinning or yourself spinning. Okay, so what that means is it doesn't mean you feel off balance, it doesn't mean you feel off. You have to actually feel yourself spinning. You might not be physically spinning, you probably aren't, but you're going to feel yourself spinning, or you're going to feel the room around you spinning. Most people will typically tell me they feel the room around them spinning, and it's typically worsened with movements. So back to the people who said they experienced vertigo. Maybe just a quick, type it in the chat. Is this what you actually experienced? Did you actually experience the room around you spinning or yourself spinning? Good. Laura says, yeah. There you go. Yeah.
Yeah. So we're seeing a little bit of both, right?
A little bit of both. Yeah. Good. So these are true, most like I'm riding a wave up or down. That is a type that is kind of like, is that vertigo or is that not? That's the kind of symptom in which we'd have to do a proper assessment to determine if it really is vertigo. But another classic sign with vertigo is it's typically worsened with movement. So for the most part, if you move your head or you move your neck, that's when you'll get these sensations. Okay, so again, I've put causes in quotations because these aren't specific causes. The studies have shown that it's multifactorial, like a lot of things is multifactorial, but for the most part, I'm going to touch on a few causes of vestibular dysfunction, meaning what's going to cause us to be imbalanced, what's going to cause us to have these dizziness symptoms. The inner ear, like that's the most common one. Most people will think it's happening in their inner ear. So this is a photo here of what it looks like inside our ear. So our ear actually has three kind of areas: the outer ear, which is the part we see, the middle ear, and the inner ear that goes right deep. We have little crystals in our ear called otoconia. They kind of supposed to sit in this little utricle here. Sometimes over time, for whatever reason, if there has been some major trauma to my head, or if I've had an ear infection, or if I've been swimming for a long time, there's a multitude of causes that can cause the otoconia or the otoliths, the little calcium crystals, to displace into these canals. And when they're in those canals and don't float back into the utricle, that's when I get this sense of I'm off. And typically I don't feel it until I move my head, because obviously my ears sit on my head, and when I move my neck, which is part of my head is attached to, my crystals aren't where they should be, and I feel off. In most people, sometimes that sense of our dizziness settling down is typically when those otoliths are going back into their place, right? And if it keeps persisting, it's probably taking longer for those otoliths to settle back into the utricle, and that's all going to depend on the type of vertigo that I'm experiencing, or what's actually causing this otoliths to get displaced. It could be just if you imagine somebody who has just ridden a roller coaster, perfectly healthy, fine. It gets displaced, and then once they get off the roller coaster, it settles back on. I'm not dizzy anymore, or I might be dizzy for a few seconds, and then I get off. Right? That might be your typical kind of day-to-day example of a regular, situation of how this could happen. Now, as it gets more serious, I might just turn my head to look up to fix a light bulb, or catch a baseball or something like that, and I get dizzy, and I might stay dizzy for like a minute, and I wonder why. that's probably likely because these otoliths have been displaced and it's taking that much time for them to settle back, or they just don't, and my body just readapts. And that's if I experience vertigo. So the symptoms with the inner ear, with BPPV, we would have to experience that classic case of vertigo. So if I'm experiencing other symptoms that I've mentioned, it might not actually be my inner ear. That's the problem. Okay. And with the vertigo, typically I'm going to, with the vestibular system dysfunction, I'm going to experience, like, it would have to be some motion involved. And that might be in terms of where my head is positioning. And there's also going to be involved a change in my balance. My proprioception is going to be off. So I'm not going to know, like, what's going on. Okay. And typically there has to be a movement component to the symptom. So if I'm sitting still and I start to feel dizzy, there's a good chance that it's not a BPPV. It's a high chance it's not a BPPV. What are some other causes that happen in the inner ear? If anybody has experienced these, you'll know. I'm not going to spend too much time in these because we don't see too much of these in the office, and they're not really the bulk of today's conversation. But you might have these conditions. And these are more chronic inner ear conditions: Meniere's, labyrinthitis, vestibular neuritis. And most of these chronic conditions will typically present with tinnitus and or hearing loss. So if a patient tells me they've been having some hearing loss or some tinnitus, I'm going to start to suspect one of these chronic inner ear conditions, in which that's when we might have to get a bit more involved on the medical side to get some, imaging and some testing done. But if you guys look here, this is what the ear looks like. So this is the inner ear. That's right there. That's the outer ear. It feeds into the canal. So it's a very, very small piece of our body that controls a lot of our balance. Okay. Acute inner ear conditions, so things that are more, that we see a bit more often, is BPV, so it's positional vertigo, and any sort of viral infection. So if you have any sort of virus that happens in our ear, even like an ear blockage due to water, it can create that sense of dizziness.
Raj, we just have a question from the group here. The question is, what about when vertigo and hearing loss have a sudden onset? And does that tell you anything about the cause?
I would, good question, Jude. I would look into further details to what is the hearing loss, and is the hearing loss temporary or is it like consistent? So in the slide that I'm mentioning, it's going to be like you're going to have long-term hearing loss. It wouldn't just happen with the vertigo, right? It would be like you've been progressively losing your hearing over time, and the ringing of the ears been getting stronger. That would indicate a chronic inner ear condition. If you're just getting hearing loss with the vertigo, that might mean more of a, sometimes it's just wax buildup. Sometimes it could be a viral infection, or it could be water in the ear or something like that. So we'd have to look into what the actual cause of that is. But my concern would be more if it's progressively getting worse or if it's consistently lasting over a period of time. Okay, so this goes to somebody else's kind of question before. Another cause of neck pain, of vertigo, of dizziness, is cervicogenic. So it's the neck. And if we just look at the neck here, a lot of these muscles of the neck, if you look into where they kind of start, where they attach into, or even where they start, is very close to the ear, as well as the muscles of the jaw. And the muscles of the jaw and the neck and even the skull muscles, they're all kind of in and around the ear. So imagine, tension that can happen in these muscles, in the jaw or in the neck. It can clearly start to affect the function of our balance system, because it's adding more tension into my ear and into that ear canal, right? Again, with neck conditions, what we call cervicogenic, typically there's a movement component to it, but also there's a sedentary component to it. So in the case of what I've been seeing recently in practice with the pandemic, it's people not moving enough. After like 4 hours of work, they start to get slightly dizzy and slightly hazy. There's a good chance that that's probably cervicogenic, and some basic neck strengthening and neck mobility might have solved that. Or there was probably some neck weakness going into that, and then it's been developing and getting worse. So, this is something I'd want to explore if somebody had these kind of symptoms. The symptoms that we would get with cervicogenic neck pain is typically that feeling of off balance, the lightheadedness, the headaches, and the nausea. Okay, you won't really get that vertigo, that room spinning component. You might get that, whoa, I feel a bit off, but that room spinning, that vertigo, that's typically related to the inner ear. And this is a diagnosis of exclusion. So it's pretty much one of those things where you can't really, like, there's no one specific test or image or maneuver that's going to release, that's going to, expose this. In practice, what I usually do is I test my patients during the assessment, and I'll usually do a little bit of work on their neck. And if I release some of the muscles in their neck or even around their jaw or the front of their neck, if they feel better and they feel like less lightheaded after, there's probably a good chance the neck had a component. The neck was involved. Okay. Mark, great question. I'm sorry to say, but your doctors are wrong. Matt, I think you'd agree with me. There is a strong component between the neck and dizziness. It's called cervicogenic dizziness. So just like you say, when you do neck exercise, it goes away a little. So it sounds like your symptoms are likely coming from the neck, and treatment and focus on the neck will probably help. Again, now we're getting into something a little bit more outside of what I would see in practice, but I wanted to make sure that we're aware of it. The brain is also a large contributor to creating dizziness symptoms. Now, this is where the central nervous system, or any sort of conditions that affect our central nervous system, so much more, cerebellar conditions or neurological conditions, but as well as concussions, can create some of these symptoms. There'll typically be a history of head injury, or a family history of neurological decline or deficit. And some of these symptoms, again, very hard, like there's not gonna be one specific symptom that says you have a neurological decline. Things like this typically involves a larger history and really understanding the patient, what's been going on. And there's some certain tests that we'd have to do in the clinic and decide, like, if this is a neurological condition, we might have to refer out. And that brings me to concussions. If it's a concussion-based neurological condition, that's fairly manageable. So you can see here in the image how a concussion is an injury to the brain. People think it's a head injury, which it is, but it's also a mild traumatic injury to the brain. This can also mean like repetitive head contact. So it doesn't have to be a direct head impact from from what we think a major concussion is. Actually, I had a soccer player who, when I asked him, have you ever had a concussion? He said no. And he was having all these symptoms, and I had to still dig in. And it wasn't until like the second or third session, we found out that he actually really used to headbutt his ball. He loved headbutting his ball. He was a professional soccer player. So years of headbutting the ball has created this micro trauma. And I wouldn't diagnose him as a concussion, but he's got some of these symptoms as a result of his brain just not processing things correctly. And so, it's sometimes not as clear cut as you pick out, but it takes a little bit of time and a little bit of investigation to figure that out. So I want to kind of take away that myth that, or that, people think that I have to like fall significantly and hurt my head to have a concussion. It could be just micro trauma over time that can create this. And then maybe another event like a big roller coaster ride or getting off of an airplane, compounded with all those little micro trauma, can now, make that concussive event a little bit harder, right? So vestibular symptoms with concussions are more likely to occur if some of the other causes are pre-existing. So if you do have neck pain or weakness, if you do have an inner ear problem, and now let's say you go and have a concussion, or you happen to have a concussion, there's probably a very high chance you're also going to have vestibular symptoms with your concussion. And some of the symptoms with concussion, again, like I mentioned, you can't really pinpoint what is concussion related or not. But concussion symptoms will definitely have a concentration and fatigue component in which the athlete or the individual just have a hard time like focusing, whether it's on their activity or on work. And they'll also get tired because the brain starts to kind of give out. The brain works just like a muscle. Once it starts tapping out, it starts to create that fatigue. Okay. Another cause could be psychological. Over time, the body physiological and primitive responses take over as a response to stress, anxiety, and fear. So, over time, our body has this natural reaction, this protective response that if there's going to be an event that's stressful physically or emotionally for me, I'm going to send I'm going to send the body this warning symptom to stop. And that typically is, if I feel dizzy or if I feel off balance, I as a person, I'm going to stop. And that likely takes place over time. That's not going to be something that happens like that. It's probably something that builds up over time. And that could be chronic injuries, that could be chronic psychological events. But typically there is a history and a combination of the previous causes. So it could be some vertigo in my history, some neck pain, some concussions, and over time, it's just, been manifested now. Even the slightest bit of anxiety can flare up my dizziness. Okay. Symptoms can be any of the symptoms, and something I've actually told some of my patients, this is for whether you think it's anxiety driven or even concussion driven, is wear a blood pressure tracker, or if you have something that can track your heart rate or your blood pressure while you're working. If something's happening and you start to see your heart rate start to rise, that probably means your body's reaching that like warning sign, right? If I'm doing something normal, like I'm just doing my work and my kids start yelling and my kids start fighting, but I start to see my heart rate rise, that might be kind of like that meter for me to like, okay, I better like sit back, do some deep breathing or something so I can lower that response and not feel that symptom of like getting dizzy. So that's the best way to track what activities are going to increase my anxiety, is by wearing a blood pressure or heart rate tracker. That should say BP and HR trackers. Okay. So physical symptoms alone are very hard to diagnose and dictate the treatment. Your root cause may lie in a multitude of these conditions: significant traumatic event, concussion, repetitive microtrauma, or repetitive or sustained load over time, right? What's been happening to you as a person that's going to help us understand you better and understand these symptoms better. A lot of these symptoms can be warning signs from chronic issues. So they might not actually be true, it might not actually truly indicate that there's something wrong with me. It's just indicating that my body's kind of reacting too quickly because it wants me to stop doing this activity. And therefore, treatment aimed at a multi-system approach to treat the individual has worked best, which means we don't just treat one thing, we try to treat the person, looking at the neck, looking at the brain, looking at the balance, looking at kind of everything at once. Can the dizziness tension come with numbness at the back of your head also? Yes, Mark, I think that's probably a symptom your nervous system is kind of sending in terms of like maybe shutting down some of the sensory receptors back there. So it's probably a good chance that, that's probably some sort of symptom that's designated with like that warning response I was mentioning, likely connected to either fatigue or neck pain. Okay, so what is vestibular and dizziness rehabilitation? At Foundation, I've been doing vestibular rehab, and I've met a lot of vestibular therapists which only treat the ear and only using the maneuvers, and that's not really my jam. I prefer to look at the whole person. And so the future vestibular therapists that we've trained, we try to look at this approach. We try to look at the entire system approach, looking at the individual and the person, not just doing those ear techniques and sending them home. That might happen in the GP's office, but I would say treatment might start there, but it doesn't end there. The purpose of the assessment, it's a 1-hour assessment, but typically like we want to determine your baseline, what's happening, what are you feeling, how can we reproduce it? We try to always reproduce your symptoms in clinic, which we tell people sometimes you might feel a bit dizzy, a bit off at the end of the session, but that allows us to understand what are your actual symptoms and what brought it on. Was it movement? Was it me kind of moving around too fast? Was it your eyes moving faster than your neck? There's so many different tests that we would conduct to determine what would provoke your dizziness. What systems and causes are involved, like I mentioned. And we want to understand that one system can affect the others, right? It's not just my neck. It's not just my ear. My ear can affect my neck because in my ear, I have BPPV. I might not move my neck as much, and therefore my neck starts to get tight. If my neck starts to get tight and I start to get stressed, it could become psychological or anxiety driven. And so these are all the things that could kind of come down that tunnel, right? Sorry, my Slack just went off there. And some systems might have a larger role than others, right? But all will have to be addressed, but maybe at the start we have to address the inner ear, then we address the neck, then we address the balance, then we address the anxiety. right? It just depends on the individual and what they're feeling and how do we get around it, right? So the key to your recovery is really your history. I like to spend a large chunk of our time really understanding the client in front of us and what makes them better, what makes them worse. What kind of medications are they on? Some certain medications can trigger these symptoms as well. What's your activity level like, or what's the activity level you want to be at? Because that can be very important, right? If you're fairly sedentary all day, that's going to tell us a little bit about your neck. That's not really, it's not really moving. What's your occupation and daily habits, right? What do you do that would involve your neck and head, and is there anxiety involved? Is there stress involved? What other physical load do you put through your body? And what are your stressors, right? That's very important, right? If you're working from home and everyone's at home and there's, children at home and there's other dogs at home and everything's going off, but likely, if you already have some of these symptoms, they're probably going to be heightened. So, unfortunately right now in the pandemic, we can't remove some of these stressors, but we probably can find ways to work around them. And what are your goals, right? The goal cannot only be symptom relief, because a lot of people know that, hey, if I don't move my neck, if I don't move my head, I don't get dizzy. So it's not just about having no symptoms. It's like, what am I looking to do without provoking symptoms? So I want to be able to move my neck all the way around. I want to be able to go for a jog. I want to be able to play baseball. I want to be able to do burpees. I want to be able to sit for most of my day, right? That's the activity load we're looking for without feeling these symptoms. And the reason why that's important is it allows us to kind of create that treatment plan as to what is your specific needs and what we need to do to help you get there. That's why we call it vestibular rehab, because it's more long-term than it is just kind of like a quick fix, right? So in terms of treatment, there's, different types of things that we would do. Repositioning maneuvers, which you've seen, that's typically done for purely inner ear conditions. And then from that, we would move on to things like manual therapy to help loosen up the neck. That involves loosening up the muscles of your neck. Postural strengthening, so that goes on to strengthening my neck and my upper back, because if my head is here, my neck muscles are strong, I have good blood flow, less likely for my neck to get tight. If my head is here all day and I can't withstand that good posture, there's a good chance I'm going to have neck tightness, get headaches, and maybe flare up my dizziness, okay? If I have some, proprioceptive deficits, like in the sense that I'm a little bit off, I want to work on gaze stability exercises, which is how do my eyes and my head and my neck move together as a unit? And there's lots of ways to challenge that. I'll show you guys that. And then finally, I might move to balance exercises. So, I might have you do stuff on 2 legs, and maybe move your legs closer together, challenge your balance, and maybe take off 1 leg and help you, learn to fix your balance of 1 leg. Why that's important? That's teaching our entire physical body, not just our neck and our ear, but our entire body, including our core and the hip muscles, to work together as a unit. Okay, so yeah, we were at the treatment options there. We're doing good for time. The repositioning maneuvers, this is truly only effective in true inner ear dysfunction, okay? So if you say you're dizzy and this Epley's isn't the maneuver that we do, we have to truly understand, is it vertigo? Is it BPPV? And is it in the specific canal in which Epley's is indicated for? Epley's is very, very specific. There's a lot of stuff on YouTube out there that's just, if you Google how to fix my dizziness, this maneuver will show up. A lot of people try it and they're not successful. The reason why people come into our offices is because they're not successful in trying this maneuver. This maneuver is also hard. If you have neck pain and tight neck muscles, there's no way you can lie off the bed and do this maneuver. So if you are indicated for it, meaning if you have the specific condition, then yes, you can do it. And likely your physiotherapist will teach you how to do it at home. They'll probably do it in the clinic first, and then we'll teach you how to do it at home, okay? If there are other systems at play, however, it'll not be effective in complete symptom relief. So it might help something, but if I have a little bit of, inner ear driven vertigo, but that's compounded with some cervicogenic dizziness, just the Epley's alone isn't going to help me. I'm going to have to do some neck work. I'm going to have to do some neck strengthening and neck stretching to help give me long-term relief, right? And this might be the reason why, they say like Epley's is the science out there has said Epley's is great for short-term relief. This might be the reason why, because I think what we're seeing is a lot of people that have the inner ear vertigo also have neck pain. And so the Epley's is fixing the inner ear component, but not fixing the neck pain or the neck stiffness. It's not fixing the neck stiffness. And maybe long-term solutions to fixing our neck posture, neck strength can help prevent recurrence of the vertigo. So in clinic, you'd be working on some manual therapy, like fixing manual therapy to the muscles and the joints of the neck and upper back. Want to make sure that we don't ignore the upper back. The upper back also is a large component in driving into our neck. If my upper back is slouched here, my head is forward, right? I can't put my head back and sit up tall unless my upper back is tall, right? And you know, we all know we have that round curve in our upper back. We might be stiff through our upper back. It might be hard. Like I can't even extend my neck up like that when my upper back is hunched over. The moment my upper back is straight, I have a lot more range in my neck. Therefore, my muscles are working better. So this is how our neck and upper back are connected, and obviously our head and inner ear are part of those components as well. Not just manual therapy though, okay? Because that's again short term. The physiotherapist can work on it with you. But what can you do at home? So how do I maintain this posture for 5-6 hours a day? I'm gonna have to strengthen my upper back and strengthen my neck. I don't want to be here, right? And sometimes it's hard. For a lot of patients, it is hard for us to sit up tall all day. That just requires a bit of strengthening and a little bit of reinforcement of those muscles. So that's what a physiotherapist will teach you. Proprioception and gaze stability exercises, I kind of showed that before. So if I turn my head and I feel a bit off and I get some of those visual disturbances, there's certain exercises I can do at home or even in clinic that helps me kind of track my eyes and my head and my neck. And some patients might be just their eyes. So just follow your finger with your eyes, or it might be eyes and head together, or it might even be something like turn your head to your left and then follow your finger, right? And I know specifically that I'm stiffer on my left side, so this is actually a harder activity for me on my left, and it starts to create a bit of headache and a little bit of like wooziness for me, versus if I was on my right, it's much easier for me to do. So for me, the exercise would actually be to reprogram my left side and do an exercise like this on my left side. So these are the kind of things that we would be teaching. And then balance exercises, like I showed before, like more higher level balance exercises when you're working out. And that could involve your core and one-legged standing type stuff. Okay. So I wanted to introduce this concept of adaptation and habituation. These symptoms don't just go away, unfortunately, and there's no pill that's going to magically help me, turn my head to the left and focus on my finger at the same time. In order for me to get better at that task, I'm going to have to repeat that task. And that's the concept of habituation. By constantly repeating that task, my body will adapt and reprogram. And I'm not telling patients go do what hurts or go do what creates your dizziness 100 times a day. It's progressive, and there's strategies that we use to help adapt and habituate. But we have to reprogram our body, especially because over time, if I haven't turned my head, that's as far as my neck turns. If I avoid turning my neck that much, I'm just not going to gain it back magically. I'm going to have to retrain it over time.
Do you see that question there from Mark?
I saw this. Yes, seasonal allergies. Great question, Rita. I have the same issues with my seasonal allergies, and I think there might be some immune system response to dizziness, but there's also I think there could also be this component of like my neck and upper body being like stressed with the allergies, with a lot of the symptoms that happen with allergies, the sneezing, the nasal drip. So that might also relate to what's happening in my canal. But I think there might also likely be an immune system response because some people do feel that their allergies are triggered, or their vertigo is triggered by allergies. So there are some more like higher level holistic type treatments you could try to manage your seasonal allergies that can trigger the vertigo. Mark, these symptoms don't ever disappear on their own. Unfortunately, if they're recurrent, Mark, like if you've been experiencing them every few weeks, every few months, they likely will need some intervention. Sometimes for the average person, it might go away and come because you've done something crazy, like you've been on a really rocky boat or you've been on a roller coaster. But if you're experiencing recurrently, you're probably going to need some intervention. Okay, and progression and challenge is necessary, and this is why you have to be guided properly along the rehab journey. Okay, so we're doing great for time. Self-management. In terms of neck strength, I forgot to show you guys there a quick little. Get ready to move if you want to learn a few strategies here. Chin tucks, I always are my go-to. So like I said, I'm not going to be teaching the Epley's maneuver right now. I don't think that is, I don't want everyone going back and doing the Epley's. These maneuvers I'm going to teach you work for everything, right? They're not going to hurt you. They're going to work for everything. They're going to work for whether it's cervicogenic, whether it's anxiety-driven, whether it's postural driven, or whether it's even BPPV, okay? It'll address some components of it. So the chin tuck's a fairly easy exercise. If I'm sitting like this, you guys can see my head is forward, right? I want to pull my shoulders back and tuck my chin in to my throat. Anyone who's been a patient of mine knows this is one of my favorite exercises, right? And I'm not putting my chin down. My chin is going into my throat. So you guys can try that as well. And I want to hold for a few seconds. And you might feel it in your abs, you might feel it down your spine, but it's a nice, clean movement in like that. And I hold it for a few seconds. And if it's difficult for you, it's okay. We might have you do it lying on your bed. It might be easier lying down than sitting up. But this is what I would recommend. And same thing for someone that's been sitting at work all day. If they're getting this kind of postural anxiety, neck-driven type of dizziness, I would recommend the shoulders back and the chin tuck, just like that. Okay? The wall angels and the postural strength. Maddie knows this is another favorite of ours. So if I was against a wall, I want to put my hands kind of back against the wall, right? So my entire shoulder blades of my spine are against the wall. And while I'm there, I'm stretching as high as I can. And again, I don't expect you to go up nice and high. Whatever you can do to help lengthen your spine is good to do. And again, I would recommend you doing it standing up so you're not sitting down. But the purpose of that exercise is to improve blood flow to the upper, through the muscles of our trapezius here and into our head, right? So again, I'm not like this. I want to be sitting up tall. I'm going to be standing against the wall. My head is tucked against the wall, so it's a nice straight line against my back. And my hands are against the wall, and I'm going up and down. And I might feel that pulling up and down through my spine, maybe even in through these muscles here. And that's a great exercise to release. Again, you don't have to be a hero day one. We work within our ranges as we get there. And finally, as a progression, the chin tucks and turns. We just gave this to a patient the other day. So we understand with vertigo and with neck pain, it's not just the action of moving my neck, but it's when I turn my head. What happens sometimes as we turn our head is our head starts here. But if my neck muscles aren't strong, I might actually do this as I turn my head. And I see this happen a lot. And when I do that, I'm actually kinking the muscles. You know, I'm tightening up the muscles here, and it's my muscles don't like it. They're going to get angry. They're going to create those symptoms again. So I want to have proper motor control when I turn my head. So I want to tuck my chin in and turn. And again, I would hold for 3 to 5 seconds, come back, keep my chin tucked, and turn. Let me just see here.
I think that for the wall angels, but there's just some clarification about what should be having full contact with the wall. Is it just hands, elbows, and shoulder blades full contact and for the entire range of motion or not?
Yes. So it's the back of my wrist and hands, elbows, and shoulders against the wall. So what you would essentially see, LC, is like my entire back, including the back of my head, is against the wall. And I want to reach that entire range of motion, but for people that are really stiff, I might not be able to, okay? And that's okay. That's my goal. My goal is to get up here, but I'll work throughout it. So if I was like this, the wall would be coming down through my upper back into my spine, and everything is against the wall. And you'll start to notice one of two things will happen. I just can't go any further, or my hands will start to come off. And maybe for that week, that's my goal. And then for week 2 or week 3, I'll try to get higher. Okay? I hope that answers your question. Awesome. Posture, motor control, and ergonomics. So obviously, save your neck and head for those work from homers, right? I'm not using a backrest while I sit, but try to use a backrest while you sit. Have your laptops or monitors raised to eye level. Remember, the more our head is here, we're going to throw those symptoms off. Okay. I don't want to be here all day. I want to be nice and tall. So even for myself, if I was on a Zoom screen, I'd tilt my screen a little bit more like that. Perfect. This is how I'd like to be as much as I can. Understandable. We can't maintain this all day. Put little sticky notes or whatever we can to help give us reminders to fix our posture. Move often. Okay. Get up and move. Typically, as we get up and go for a walk and come back, we typically maintain better posture. Throughout the day, for those of us that have experienced dizziness, when we say move your neck through range, we don't want you to move it too fast because that's going to trigger your symptoms. We want you to move it nice and slow and comfortably through your ranges. So like that chin tuck and turn throughout the day, take your little computer break, turn my head to the right, back to the middle, turn my head to the left. If I'm comfortable going side to side, I go side to side. And then if I can look up, I can look up, and I can look down. And I understand for some of us, looking up might trigger dizziness. So maybe we don't do that, but we do the movements we can do. And you'll learn through rehab how to move your head up better. Okay, this is important. Has anybody experienced issues getting up out of bed? Do they feel dizzy getting up out of bed? I can't see the chat there, Matt, so I'm not sure if anybody said anything. Oh, there we go. Yes, mostly in the morning before work. Yes. So this is exactly why. So the reason why we get dizzy when we get out of bed is we're only using our head to help us get out of bed. And imagine you've been sleeping for 8 hours, or if you're sleeping on your side, and then you just all of a sudden demand of your neck to lead the charge, to get out of bed. So if I'm sleeping on my side, time to wake up, and I just get up. My neck doesn't like that. That's like, just throwing my head, moving my whole 200-pound body. My neck doesn't like that. I'm not using the rest of my body to help me, especially if I'm having these symptoms of dizziness or weaker neck. It's going to trigger those symptoms. So a management strategy for people who get these issues when they're sleeping or getting out of bed, I always just roll onto your back first. Okay, don't just get up from the side. Roll onto your back slowly. Remove any sort of pillows or anything out of the way and lengthen your body. So arms straight, legs straight, pull shoulder blades back and tuck your chin in. Okay? And as you're there, you take a few deep breaths to oxygenate. And when you get up, don't do what the lady in the photo is doing where she's using her head to get up. What she's doing there is all of the stress of her body is being put on those neck muscles. And if the neck muscles feel stressed, they're going to send dizziness to you. Use your abs. Contract your abs while breathing to get up. Almost like relieving your head of its duty, right? So it doesn't have to do all that work. So don't do.
There's a good question here. Yeah. Follow with that. What about pillows and sleeping flat versus side sleeping? And does pillows make a difference?
Good question, Mark. I would suggest if you're experiencing, I know you've mentioned you have some symptoms. If you're experiencing these symptoms, you likely want to keep your head neutral. And this is, I haven't assessed you, so I don't want to kind of say that out. So it's going to help you, but most likely keeping your head neutral will help. So if you're sleeping on your side, if I'm sleeping like this, it probably wouldn't be good for me. I might need enough pillows depending on how wide my shoulders are. So I have, a lot of width here. I need pillows between the bed and my head to keep my head neutral, right? So I don't fall onto that side as much. Okay. So sleeping on for those sleeps, for those side sleepers, I clearly want to keep my head neutral. Okay. So stretching, not always recommended. Okay, I don't recommend long-term stretching for us. Not until you've been seen by a physiotherapist. I don't suggest a lot of stretching yet. It's the strengthening component that we suggest. Some other exercises you can try are the gaze stability exercises. So I talked to you guys about what we did with my finger. I can use maps like this where I'm looking at the A line and tracking the A line with just my eyes. I can move with my eyes and my head like this. Or again, I can move my head to one side and then track a line. And move my head to another side, and track a line. And trust me, it's difficult. And if I move my head up, track a line, with all the confusion and the different stimulation there, I'm going to have to focus and reduce that, those symptoms. So I might, with a patient who's extremely dizzy, maybe just start with one line. And then as that gets easier, start with the other line, add 2 lines in. So there's a bit more confusion. And then add 4 lines in. And if it's the left side that triggers them, I might say, turn to your left and now track A, right? And turn to your left and look up and track A. As you can see, it can get really difficult, and it all just depends on how much you can handle, okay? And finally, you can challenge other systems while exercising. So you can stand on one leg while you're working out. You can change the lighting and the noise input while you're working out. Be careful if you're going to close your eyes. It's a great, great balance exercise. If you close your eyes, just imagine even just standing on one leg, lifting your normal weights, and then close your eyes, stand on 2 legs, and lift your normal weights. You just really have to challenge your balance system to another degree, and that's a real good way to, if you've reached a good point in your rehab, to prevent further dizziness. What we're trying to do here is bulletproof your body and have your body functioning at such a high level that your day-to-day activities don't trigger it as much. That's it. Thank you. Go Leafs, go.
I don't know if you know much about this, Raj, but there is a question or a comment about trying meditation at the end of a long day after looking at the screen too long. Do you have any knowledge about that?
Like I said, I know there are better holistic practitioners than myself, but I do agree that some sort of like meditation and deep breathing do help. I think it improves oxygenation, which is obviously the blood flow through our body. And so if I've been tense and sitting all day, then the concept of meditation, it goes back to that concept of just removing those stressors, right? So from that perspective, meditation will help. And if you find that that's what helps you, by all means. And like I mentioned, that some of our patients, we do look a little bit beyond the regular scope of physio. So I do tend to use a more holistic approach with some of my patients who have these conditions, because it does require a more holistic approach. You can't just have like a one-size-fit-all approach. You can't just do this maneuver and go, or stretch my neck and go. There's a little bit more involved, and the more stressors in your life, or the longer you've had these conditions, there's more to be treated. But understand that it's a process and it takes time. We've had very successful results with a lot of our patients, but it's a two-way street, right? We need to work at it. And as most of you who are on this call or have probably understood, and myself with practice, there's also not a lot of medications out there that can fix all these things. So it is a bit of a journey, but the light's always at the end of the tunnel. Thank you, Sherry and Linda. Appreciate it. I just see here, Austin, with vertigo, should I avoid to sleep on my side as my vertigo was triggered when turning in the bed from one side to the other? As a general rule of thumb, Austin, if you know which side you get dizzy on, so if you know that, like, if you're getting vertigo when you turn your head to the left, I would avoid sleeping on my left. I would sleep on the right or my back. Joanne, yes, we will be getting a copy of this. We'll be emailing this out, right, Matt?
So we'll be emailing the link tomorrow evening to the YouTube channel where it's going to stay live and available if you want to watch it again or you want to send it to any friends or family. That'll be coming from the automated Zoom link. Zoom email.
Jennifer, I have no dizziness issues, but candlelight, I missed that here. Candlelight at dinner party sent me to 3 hours vertigo. Interesting. If you want to send me a quick email, we could look into that. That's probably some sort of like visual thing that might be happening. There are, neuro-optometrists that will work on like what's happening with your vision, but it could be something connecting with your vision that's triggering your dizziness. Mark, yes, cardio can trigger the neck vertigo, of course. If I'm running or if I'm playing hockey and my shoulders are like this all the time, I'm going to be tensing up this area. we do get complaints from runners. One of the biggest activities that some younger patients say they have a hard time doing is going back to running because they get dizzy after the run. It's likely due to the posture of their shoulders while running. Another question here. Yep. Out of anonymity, I'll mention that, yes, this can cause anxiety. This is a very, from a symptom perspective, it is kind of scary for people that have never experienced it. I would say you are not alone. 90% of my patients say they feel anxious when they get these symptoms, and that triggers their symptoms to get worse. So a lot of our, hopefully even this presentation can help calm down some of those myths that it is resolvable. It just takes a little bit of time, a little bit of work, but there is an ability to correct it. And can you drink coffee and eat sugar? Does that affect the neck dizziness? That I can't answer fully. I know there's definitely one naturopath on this call who might be able to better answer that question, but unfortunately I am not, I don't have the scope to answer what nutrition does for your symptoms. Oh, there you go. Mark, there you got some free advice there. I am fine, but I can't look at the ink. What's that?
I was just going to read that question out for you. I didn't know if you saw that, but that's a good one. That's a common
one. Oh, yeah.
Post-concussion. I see that a lot as well.
With the running, Matt?
Sorry, no, with the walking in the grocery aisle and having trouble keeping eyes fixated, causing lightheaded and nausea.
Oh, yes.
And
I'm just seeing that now. Yes, walking the.
Some of that gaze stuff you were talking about, I think, plays into this as well. But I'll let you answer.
Yeah, sure. So I don't know your history, but this is the same thing where multiple systems are at work. So when I'm in a grocery store, I have noise, I have lights, I have my balance, I'm in a different environment. I have sounds going off. So my brain is really overstimulated. And so my brain's way of sending hey, we need to get out of here. My brain sends me that sense of dizziness, right? And I start to get lightheaded and nauseous. So that's my brain's response system, is that primitive response system kicking in. So this is where some habituation and adaptation would be important, right? Where it could be as simple as, this is a longer term kind of rehab strategy. It could be as simple as blocking off, sound. If I'm at a grocery store, I don't need to hear the extra sensation, so I can put on earmuffs. It could be, we sometimes have people wear glasses and kind of occlude the outside or the inside so that all peripheral vision is taken care of. So my eyes don't have to have as much colors and stimulation as it needs to. So there are certain strategies that we would use, and I would, if this was someone that was talking to me, I would dig deep into what is happening specifically in the grocery aisle that we can eliminate slowly, and then slowly add back into your life, so that you don't have to live like this forever. We'll just add it back in as you get stronger and better. Any other questions? Yep, it's completely normal. It's completely normal that you will get feelings of nausea, like I mentioned. It's this weird sensation, this sensation of dizziness. And so how does our body respond, right? It's like if I'm scared of something, I might get this little weird nausea. It's very normal that the nausea or any of those other types of symptoms could be related to another symptom, that one symptom causes others. If we start to remove just one symptom, like just the tension going away, then other symptoms start to feel better. So again, you want to explore and understand what's happening, but understand that it is normal to feel all these things together. I have never heard of shirt patterns causing vertigo, but I can understand why. If you looked at that kind of gaze stability exercise I showed you, it could probably cause vertigo for some people, right? So it all just depends on the lighting and what's happening. Maybe tell your colleagues to wear different shirts.
I would your shirts give me vertigo, but that's not with vertigo symptoms. That's just those shirt patterns.
I do want to mention that there are, if people do get kind of if there's more visual things, there are visual strategies as well. I didn't get into that, but that's a little bit kind of I do put a little bit out to my practice, but there are certain strategies that we use. Some people wear sunglasses to block out extra light. Some people will wear certain tints on their glasses. Some people will kind of, wear glasses and then tape off the edges because too much stimulation can affect my eyes. And that usually means there's some sort of, that might be something that happens post-concussion or from some other neurological condition. Yes, exactly. To answer your question, Mark, yes, neck tension can create rib pain, back pain, and musculoskeletal pain. It's probably all connected. It's what I was talking about, your upper back and your neck can all be connected. Laura, I don't want to, I don't want to go on for another hour, so I'm not going to answer your question. Thank you, Jennifer. Anyways, I hope that was helpful for you guys. We're kind of reaching the time right now. I know we all want to get to the Leafs game. So, yes, Austin, heart conditions can as well. We'd have to look into a cardiac, we'd have to explore that in further detail. Please do, if you have any questions at all, I encourage all of you to email me. I do a 15-minute discovery call with people as well, so it's all virtual. Or if you prefer, if you don't want to do it over the screen because it creates symptoms, we'll do it over the phone. But you can book it with me as well. So just find a time in my schedule, and I'm happy to call you or set up a Zoom call, and we can discuss your symptoms and see how our services can help you. And you're more than welcome to follow the clinic and follow myself on social and cheer on. If you don't cheer on the Leafs, then I don't know what to do or what to say, but Matt won't be a big fan of you, but go Leafs go. So there's all my information. Take a screenshot. I hope to hear from you guys.
Thank you, everybody, for attending. You'll all get an email tomorrow with Raj's email, as well as his social handle in case you want to follow Raj's day-to-day life, as well as our YouTube channel.
It's just me and my kids, really, but
We have just today's on the YouTube channel, not just today's session, but all of our sessions in the past, which you're more than you'd be very thankful if you share that with your friends and colleagues for anybody who might be having this issue as well. And other than that, thank you very much. Go Leafs, go. And we look forward to seeing you guys again soon. Have a good night, guys.
Thank you, guys. Have a great one. Bye.